facilitation policy has been suspended. It was suspended early this week, and we've been giving you the details of how this story has been moving. And the government has reversed or suspended the controversial policy that had caused major concern among medical interns. Now, the cabinet resolved that medical interns should continue receiving facilitation following the controversy surrounding the proposed changes, and reports indicate that government committed to paying interns a monthly facilitation of 1 million shillings. However, you may also figure around you may also hear that you may also hear about some figures of 1.26 million shillings in reporting concern that existing facilitation arrangement, including taxation. So I would pose a question and ask why has this become very controversial? Medical internship is a mandatory a practical training stage for many health professionals after university. We recently hosted someone from the medical internship, was it a forum or something? And he was telling us that most of the people actually thought that these are students that are still studying, and that's what most of us thought. Yet these are people that have graduated and that have that particular year of practicing in hospitals. They are placed in two different hospitals and they do practice, but there is a lot more these people do. They work for long hours compared to even the doctors. But we thank the government. It has done something about it, and they will continue receiving their facilitation. And I don't know, you posed a question earlier this week, should we always demonstrate, or
are we supposed to protest so that they get to know what we are?
So that we can...
Yes, I believe there are very many different channels on how we can communicate with the government, but the question is, and surprisingly, when we demonstrate or when people demonstrate or protest, that's when the government acts. For example, you remember the teachers were on strike for a certain period of time, an increment on their salary. And that's when we saw the government under the Ministry of Education came out and actually worked upon their problems. Now, the same applies to the medical internees, and it's not their first time to be doing protests concerning their facilitation. They've been doing this for a certain period of time, years and years and years. They keep on changing the policies.
At first it was 2.5 in 2021, I think. And now they are receiving
1.226, which is okay. Being that maybe the government did not have money, but at least you have to facilitate individuals that work for you. You cannot tell me that someone will come in and give you a service and you do not pay back, because actually these people or the internees provide the service to patients, and they're supposed to be compensated for that, regardless that maybe they are still under a certain training. But if you remember, even Honorable the Minister, that is Chris Baliomonsi, when he visited, when he stormed off Ambala Regional Hospital, without the authorities knowing that he will be there at night. He found out that doctors weren't there at the moment, but medical internees were on ground providing medical services to patients. And when he came onto the floor of Parliament, actually he mentioned it and said that the medical internees play a very big role when it comes to the health sector of Uganda, being that they do most of the work compared to to the doctors. You get the point?
Yes.
And so now, what I'm saying is, these people, just like you just mentioned it, that they work for long hours compared to doctors. You find one doctor is supposed to attend to over 500 patients.
These are fresh doctors.
And
they
their
have
minds
the
are very fresh, passionate about what they're doing.
Dedicated to what they're doing.
Yes, so I think, and I'm really glad that the policy has been suspended by the cabinet, being that they had proposed that only that were sponsored by the government are the only one entitled to receive this facilitation. But later on, I like it that the policy has been taken back to be revised to see how better they can work hand in hand with these internees, because these internees actually are the doctors of tomorrow. You get the
Yeah,
point?
they are.
And we cannot fail to accept
If they're
that.
demotivated, I don't know what is happening.
And we cannot fail to accept that we do not have enough doctors in hospitals. This has been a problem, just like how it is in the judicial sector. They say that we do not have enough judges, yet we have students that usually graduate on a yearly basis. You get the point. But people do not even want to work for the government for such things.
I went ahead and asked the question that what really happens to the young people that are trying to pursue their dream in the medical fraternity if this is happening? Because when you look at things, we do need the doctors, and we still do need doctors because they deal with people's lives.
We do need doctors because for starters, besides us needing the doctors, our health sector is not doing fine because it lacks manpower, it lacks the facilitation, modern science equipment. We lack all such things. But now at least we would have had the doctors. Then later on, they work on the modern science equipments that are on the market at the moment. You get the point? But if at all we do not have any of those, then I don't really know. But we do need these doctors in Uganda, because I usually talk about what the president said years back when our doctors were protesting, and also medical interns, and he said that if you do not want to work, then of course we shall bring in the Cuban doctors. But the Cuban doctors will be taking money, not so. It is better you solve the problem right now than running away from it, and then you bring someone else. It will be the same case, and the Cuban doctors will be expensive compared to those that are in Uganda. So I think it's better the Ministry of Health should go back, revise, just like how they have done, thanks to the cabinet, that they have been able to see where the mistakes were when they came up with this facilitation policy for the internees, and how better they can work hand in hand with the Ministry of Health, because Minister Chris Baliomus came out and highlighted onto the floor of Parliament how important these medical internees are when it comes to the health sector. They do so well.
But of course, Regan, we cannot fail to talk about the fact that government had also argued that internship is primarily professional training rather than employment, and that the increasing number of medical graduates made the old system financially difficult to sustain. And why did actually the interns oppose it? Medical interns argued that they are essential to Uganda's hospitals, often are working extremely long shifts, just like we've been mentioning, while providing actual patient care. And the issue became particularly serious because the government initially told the interns to report to their assigned hospitals or risk losing their placements. Medical associations warned that this could lead to industrial action and disrupt healthcare services. And these people were actually demonstrating, and they refused to go to the hospitals where they were placed. There were many even protests in Kampala, and 8 medical interns and health workers were remanded in court after being arrested during a demonstration demanding payment. So we want to delve into what our government has actually decided on this particular issue. On 18th August, Health Minister Chris Baliomus told Parliament that Cabinet had suspended the controversial facilitation provision for the current cohort. All 2,490 medical interns deployed across 77 accredited centers will receive the same allowances, and that is 1.26 per month before tax, approximately to Ugandan shillings, that is 1 million.
1 million, yes.
So the actual money they will be getting is 1 million when you remove the taxes that they're supposed to pay. So importantly, privately sponsored interns will not be left with the much lower proposed allowance for this cohort. Dr. Chris Baliomus earlier on came out and said that at first, he said that doctors that are privately sponsored, they will not get these allowances, but those that were that are government sponsored will go ahead and get the allowances, which did not make sense to medical interns. That's why they had to come out and protest, and that this has been taken back. Now, Parliament itself confirmed that government had stayed the proposal, and that all medical interns would receive the 1 million shillings net monthly allowance. Now, Cabinet also dropped another controversial proposal that would have made the students complete their internship before receiving their university degree. Now, Uganda's government tried to reform medical training and reduce change internship facilitation. Interns and doctors strongly resisted. Protests followed, and Cabinet has now backed down for the current cohort, restoring equal monthly facilitation, be it you're privately sponsored, be it you were sponsored by government, you will receive the same money. On this particular